Do you or someone you know have cancer or an illness someone has told you is, quote, life-threatening? Do you lie awake at night wondering why so much money is spent each year on cancer research and there still is no cure in 2006? Well, we're going to be talking about major medical cover-ups and the politics in our healthcare system with a champion for medical freedom, Dr. Julian Whitaker. You're listening to Coast AM. Hi, I'm Lisa Garr, sitting in for Art Bell. Did you know 1 American dies of cancer every minute? I had just mentioned this. Now, that's, if you think about it, that's 1,440 people a day. I'll do the math for you. Or the equivalent of 3 fully loaded 747s crashing and killing everyone aboard every day. Why don't we have a war on cancer? According to a book by medical author Dan Haley called Politics and Healing, this is an incredible book. He says that as we speak, there are solutions for cancer that have effectively worked for people and animals. However, they are relentlessly being suppressed by certain organizations. Now, you can barely even get that book in the bookstores any longer, although it was just published in 2002. It's definitely a conspiracy here with all of the money spent on cancer research and all of the other terminal illnesses and all of the great minds and the companies and the studies done on cancer research. It's 2006. Why haven't we found a solution yet? Maybe you've donated money to a cancer or research society, or maybe you've even volunteered your time. Well, Dr. Julian Whitaker is joining me, who is a traditional medical doctor. He's a member of the AMA, and he is a tireless crusader against abuses by the FDA and a champion for medical freedom. Dr. Whitaker, why do you think 1 American dies every 3 to 5 minutes from the effects of pharmaceutical drugs?
Well, I think the pharmaceutical drugs have actually taken over the whole medical establishment. They make so much money from their patented drugs that they have perverted the research process. They own the New England Journal of Medicine. They virtually dictate what the American Medical Association does, and they pay the salaries of the FDA. It's like they are in complete control of the information that gets out to doctors, of what doctors read. They're in almost complete control of the science that is published, and basically even what they look at. And it's amazing to me that it has occurred to such an extent where everything that is done in medicine is to promote drug sales.
It's really interesting. I just read a report in the news about the devices that the pharmaceutical salespeople, which consist of like 90,000 representatives, bring into the doctor's offices when they promote their drugs to these doctors. And now they're going to be able to track the types of drugs that the doctor uses and how much they use these drugs and how they compare to the regular approach. And so basically this is not only invasive upon doctor's time, which will take away from your time in the doctor's office, but this is also a conflict for the patient's records.
Oh, absolutely. I think it's a testimony of some kind, in that I have not had a pharmaceutical representative in my office in 20 years. They know that I'm on to them. I publish a newsletter, as you may know, that goes out to 250,000 people a month, and I have been doing that for 15 years, and there's no question that I understand the nature of this selling of the prescription drugs, of their manipulating the data, of their not publishing negative data, of their skirting the data, of their... There's a recent book out that I'll mention to your listeners, and I didn't write it, but it goes into even more detail than I've ever gone into in looking at this problem. It's called Overdosed America. It's by John Abramson, and he is a clinical associate professor. I'm not exactly sure what his title is at Harvard, and he was in family practice, an active clinician, and he was a researcher, and he has pinpointed how over the years, particularly over the last 15 years, we are going backwards in our healthcare system. With our embracing of the pharmaceutical companies, we now have the worst healthcare system in the world. And here's the data for that. The World Health Organization measures and plots interesting, objective data. And one of their plottings is healthy life expectancy. Now, this is how long someone lives before disease takes him out of participation. He may get a debilitating disease and carry on for 4 or 5 more years, but his healthy life ends when he becomes debilitated. Out of the 24 richest countries, the United States ranks 23rd. The Czech Republic is the only one below us. Yet, if we look at our medical care, we pay about $6,000 per person per year, which is twice as much as many of the other countries, and a third as much as Japan pays, that has the highest healthy life expectancy. So basically, our system has been converted into a system where we pay the most by far to be the worst. And there's no equivocation on this data. The data is solid, and as he points out, it is confirmed in other studies as well. It all has to do with commercialization of the pharmaceutical company, all of the ads you see on TV, all the disease mongering about lowering your cholesterol level, the disease mongering about osteoporosis, the disease mongering about high blood pressure. They kind of disease monger by creating an illness out of the normal process of living or aging that has a drug tied to it.